of nurse in empowering others. Nurses and nurse managers must be empowered to perform their leadership roles, to facilitate positive patient outcomes. Empowerment is possible when employees have access to information, support, resources, and the chance to discover and develop. A definition: nursing empowerment has been defining as the ability to effectively motivate and mobilize self and others to accomplish positive outcomes in nursing practice and work environment. Quality improvement is an organized process that accesses and evaluates health services to improve practice or quality of care. Role of the nurse. One, assessment. 2, care. 3, coordinator. 4, communicator. 5, teacher. 6, counselor. 7, manager. 8, leader. 9, team player. 10, motivator. 11, delegator. 12, critical thinker. 13, innovator. 14, researcher. 15, advocate. Detail going on. 1, assessment. A nursing assessment is a process where a nurse gathers and analyzes a patient's health information using evidence-informed tools to learn more about a patient's overall health, symptoms, and concerns. This includes considering the patient's biological, social, psychological, cultural, and spiritual values and beliefs. A nurse then documents and interprets this information to inform the patient's care plan and ongoing decision making about the patient's health status, which may include identifying urgent, emergent, and or life-threatening conditions. Second, care. Nursing encompasses autonomous and collaborative care of individuals of all ages, families, groups, and communities, sick or well, and in all settings. Nursing includes the promotion of health, prevention of illness, and the care of ill, disabilities, and dying people. 3. Coordinator. A nurse care coordinator is a registered nurse who organizes treatment plans between the patient and medical team. The primary groups of patients they work with have specific diagnosis that require treatment either inside or outside of the hospital to empowering everyone. 4. Communicator. Nurse establish therapeutic relationship and assertive communicator. Good communication in healthcare means approaching every patient interaction with the intention to understand the patient's concerns, experiences, and opinions. This includes using verbal, non-verbal communication skills, also with active listening and patient teach back techniques to empowering client and others. 5. Teacher. Educate patient to develop self-abilities, provide knowledge to all patients to make informed decisions, demonstrate need, skills, promote health, prevent illness, restore health, facilitate coping and empowering. They act as mentors and teachers, providing realistic prospects for nursing student empowerment. 6. Counsellor. Counseling is a series of direct contact with the individual, which aims to offer him assistance in changing the attitudes and behavior, assist and guide patient in solving problems or making decisions, utilize the interpersonal relationship. Nurse does not tell patient how to solve the problem, guide patient to decisions, self-determination, and empowering others. 7. Manager. Nurse managers are responsible for managing human and financial resources, ensuring patient and staff satisfaction, maintaining a safe environment for staff, patients, and visitors, ensuring standards and quality of care are maintained, and aligning the unit's goals with the hospital's strategic goals. 8. Leader. A leader is someone who inspires passing and motivation in followers. A nurse as a leader often has a clinical specialty of some kind. They focus on patient quality of care and safety, but at a higher level, leading teams of managers and registered nurses. In addition to leading clinical teams, these leaders advocate to empowering others. 9. Team player. A team player is a person who plays or works well as a member of team or group. A good nurse is a team player who is not only focused on attending to her own workload, but realizing that she is a part of team and doing whatever is necessary to ensure that the required tasks get carried out. 10. Motivator. Used to motivate patients to take ownership of their health. Nurse leaders display different types of motivation. These are driven by 3 basic needs: autonomy, leadership, relatedness, and competence. The need for autonomy and competence relates to engaging with tasks that leaders find interesting and promote growth in their autonomy, competence to empowering others. 11. Delegator. Someone who delegates part of their job, duties, etc. The delegator is a registered nurse who distributes a portion of patient care to the delegate based on individual states' nurse practice acts. Registered nurses have a professional duty to perform patient care tasks dependably and reliably. 12. Critical thinker. Critical thinking is applied by nurses in the process of solving problems of patients and decision-making process with creativity to enhance the effect. It is an essential process for a safe, efficient, and skillful nursing intervention. 13. Innovator. A nurse innovator is a nurse who specializes in bringing forth positive change in healthcare quality and equity by addressing the unmet needs of a target population through new products, process, and services to empowering others. 14. Researcher. Nurse is a researcher or scientist who study various aspects of health, illness, healthcare by designing and implementing scientific studies. They look for ways to improve healthcare services and healthcare outcomes. 15. Advocate. A nurse advocate is a nurse who works on behalf of patients to maintain quality of care and protect patients' rights. They intervene when there is a care concern and following the proper channels works to resolve any patient's care issues. Realistically, every nurse is an advocate to empowering others.
Thank you. Have a nice day.